Have you thought about why cancer patients have to lay on their back when they are treated with radiation? Why can't they sit or stand up instead? I mean, for the last 4 decades, we have been treating patients like this. The patient is laying down on a couch while having a heavy advanced machine rotating around them to take X-ray images and delivering radiation to the cancer in aim to kill the cancer cells. And this technology has been working wonderfully so far. But we are wondering about what happens if the patient sits on a chair or stand up instead. Are there any consequences or benefits to this crazy idea? Or was it basically just because of the lack of technology that we haven't been able to do it so far? So basically what we are wondering is, can we treat cancer while sitting on a chair? And luckily enough, there is a company in London that is exploring the same idea. But there is one challenge. They are in London and we are in Sweden. So we had to travel from Sweden to London to see their product, to review it, to understand about its benefits and about its limitations, to tell you all about it today. So without any further ado, let's begin. So we are visiting Leo Cancer Care today, a company developing the field of upright radiotherapy, which means using radiation to treat cancer while sitting down or standing up instead of laying down. And this is their product Eve, which consists of a fully automated and flexible chair components with different degrees of freedom. A carbon fiber backrest, a seat pan, a shin rest, a heel stop, and an arm support fixed to the edges of the backrest. However, this specific one shown here is just a prototype. The chair can rotate clockwise or counterclockwise at different speeds from 1 up to 3 rotations per minute and move vertically up in the air to 70 centimeters. You can also combine the rotation of the chair with this vertical movement to create what we call a helical treatment or a spiral type of treatment. On the top of that, they have developed their own vertical CT scanner. They use proton and photon linear accelerators and an optical guidance system to make sure that the patient is positioned correctly. Okay, to the fun part, let's show you how it works. Me and Yasser wanted to try the patient setup, so they started first by using vacuum cushions to shape the seat according to the body shape. Then while sitting down on the cushion, the heels need to be inside the heel stop. Next, the shin rest moves closer to the knees while having the heels inside the heel stop to ensure an optimal fixation. And just like that, it becomes so comfortable to be in this chair.
Do you want it tighter or?
No, this is great.
The shin rest and the heel stop remove all the tension from the leg muscles and hip and made us completely relax from the hip down, while the backrest is supporting the back and neck. The abdominal belt you're seeing here allows the upper body to feel even more fixed and relaxed, so we don't have to use any muscles to keep sitting straight. This setup can definitely offer an accurate treatment and positioning of cancer patients. And since we're talking about accuracy, here you go. We also wanted to ask the company's CEO, Stephen Toe, who has an engineering background, to explain to us what made them invest in this idea and why not just copy the same way we are treating cancer today.
Yeah, I think it's an easy thing, isn't it, with any area of technology to look at something and say, it kind of functions, it kind of does what it's supposed to do today. And there's that old saying, if it ain't broke, don't fix it. The two things that don't get questioned, that all patients are treated lay down, either supine or prone, and that the radiation always rotates around the patient. We don't question those things. And actually, we're challenging both of them at the same time. I think the reason that we're doing it is because the value that it brings in changing those two things at the same time is so enormous. You very, very rarely see anything in healthcare where you have an opportunity to make something better at the same time as reducing the cost. It's really easy to do one or the other.
This is possible if we move the patient instead of the heavy source of radiation. And the fact that it's a bit cheaper than other machines allow countries and other clinics that have limited resources to still be able to offer high quality treatments to their cancer patients. Now, before we move on to the benefits, I would like to tell you first about the limitations and challenges that are facing the field of upright radiotherapy right now. The first one being the lack of vertex or non-coplanar beams possibilities, where we can have more freedom to target cancer from different angles to reduce the dose to healthy tissues. This is just a consequence of the design of the upright radiotherapy machines today, but it might change in the future. The second limitation is Patients who have leg, knee, or hip injuries might find it easier to lie down to release the pressure instead of having things holding or pressing on these areas. The third limitation is the lack of vertical PET or MRI scanners in the market that need to be used to minimize the uncertainty of deformable image registrations. Now, Stephen did mention a potential solution that can be used in this case. The patient can be first scanned in both supine and upright positions using their special vertical CT scanner. Then take the calculated deformation vectors from these images and apply them to the MRI and PET scans. But still, image registration could be very hard sometimes, so it's worth mentioning that there could be some uncertainties in that method. The fourth limitation is that the cancers or tumors that are located below the pelvis area are very challenging to treat with such a setup, as the mechanical components and leg position make the treatment a bit more complex. And the last limitation that I personally see is the treatment of pediatric patients, children. They are either sedated or have complex positioning setups when not treated today. And for that patient group, some additional work and solutions has to be developed if the upright radiotherapy field would like to cover that patient group too. Moving on to the exciting part. Are there any benefits at all to treat patients while sitting on a chair or standing up? And the first benefit that we learned about is the reduced motion of organs when the patient is standing up or sitting down and compared to laying on their back. This is extremely important for accurate treatment of lung and liver cancer, thanks to the gravitational pull and maintaining the same posture during treatment as when normally standing or sitting down. The lung motion can be reduced by 5 mm based on published study by MD Anderson. The second benefit is that it's cheap or cheaper, and that's very important, as I mentioned before, to allow more clinics to buy more machines to treat more patients. And the third benefit is that it's very comfortable from what we experienced and based on the research and feedbacks of patients. But there are more clinical studies on the way, so we'll see if they confirm that too. And then the last benefit is the psychological comfort from being able to see the surrounding of the room and working staff, which can make you feel less vulnerable in a sense. It's hard to have that when you are laying down, according to the patients. By the way, there are also very exciting collaborations between Leo Cancer Care and other major players in the field of radiotherapy, like the company Sifco for positioning solutions and the company Research for treatment planning. And this is exciting to know because it means that these collaborations will always contribute in continuous development of this technology, since the field of radiotherapy is developing all the time. Now, in summary, the field of upright radiotherapy seems very exciting, and it will be really interesting to read the future articles, the clinical studies, to see the benefits or limitations and other challenges you have with more patients' data available. And if you have any questions or feedback to us, don't hesitate to leave it down in the comment sections. Thank you so much for watching, and I'll see you in the next one.